Hi, this is Dr. Harris Meyer coming to you from downtown San Francisco, California. I wanted to talk with you today about a question that I hear from a lot of people, particularly new patients, and that is, why would I want to see a chiropractor if I'm not in pain? Isn't that what chiropractic is all about? Well, the answer is chiropractic is terrific for dealing with pain, especially when it comes to pain that happens to be in the back or the neck, headaches, things like that, even extremities, honestly. But there is so much more to chiropractic than just treating pain. And so I'm going to ask you for the next couple of moments to just open your mind up and allow yourself to hear what I'm going to say and understand the reality of this. So it's our nervous system, our central nervous system, that controls every single thing that happens in our body. And the nervous system is broken down into three main categories, really. One of the categories is sensation. Well, we all know what sensation is like. When we are hurting, that's a sensation. If we have a headache or if we scratch our arm, if we feel warm or cold, those are sensations. Honestly though, sensation is really the smallest part of our nervous system as a whole. And the other two categories of our nervous system make up a much bigger part of it. And so there are many more nerves dedicated to their actions and their functions than to sensation. So the other two categories are the motor system, which is responsible for your muscles and all movement that we have in the body. And the last segment of the nervous system is what we call the autonomic nervous system. And this is what's responsible for controlling everything that happens internally, all of our glands, all of our organs, including the heart, our blood vessels, our blood pressure, and things like that. So in the spine, signals are sent to run the body, whether it's signals for sensation or for action and movement or for internal organ functioning. They come from the brain and they are sent down the spinal cord, which is inside the middle of the bony spinal column, which, as we know, is freely movable because we're able to move. And then those signals come out along these, which are called spinal nerves. And this goes beyond our central nervous system into what we call the peripheral nervous system. And the spinal nerves send the signals to every cell of the body so that they can receive and send the information needed to run our body to and from the brain. Well, sometimes we get misalignments in the spine, and that can put pressure on the spaces where the nerves come out from the spinal cord. And if there's pressure on there, then these nerves aren't able to function optimally. But we want them to. We need a lot of information coming from the spinal cord getting to the rest of the body and vice versa. If we put pressure on that, we're going to hinder some of that activity. This is what we call subluxation. And this is a condition that chiropractors look for every day. When we find subluxation in the body, we want to try and diminish it as much as possible or get rid of it entirely if that's possible. So as a chiropractor feels or palpates the spine, we're looking for areas where the bones aren't lined properly or they don't seem to function properly and move in the right way. And what the chiropractor will do is try to restore normal functioning to that area. And when we can do that, we know that we relieve the pressure on these nerves, and then the information going to and from the brain is relieved and is able to function the way it's supposed to. So again, if I don't have any pain, people will say, why should I go see a chiropractor? Well, we want our nervous system to function properly. If it doesn't, then other parts of our body won't function properly, and we are going to age prematurely, and we're not going to be very healthy. So it's very advisable to make sure that our spine is functioning well and that we have chiropractic checkups so that we can find out if we have these subluxations, and if we do, to try and reduce them or get rid of them as early as possible. So I know this is really a big topic, and if you have further questions about this and you would like to talk with me about it, I'm absolutely open to that. You can reach me by email at docmeyer@bodyfocushealth.com. Or feel free to go to our website. You can reach us through there. You can also call us. The web address is www.bodyfocushealth.com. And our phone number is 415-956-3226. Please get in touch with us.